Most ladies in the audience have probably experienced some form of the often painful cramps that accompany a period when that time of the month rolls around. However, imagine experiencing this pain throughout the entire month, chronically. Now imagine how this pain may impact your life, your mood, and for the men in the audience, it may impact your family's ability to get pregnant. Endometriosis is a condition in which the lining of the uterus is found outside of the uterus, causing severe pelvic pain. It is fairly common, affecting nearly 5 million American women, including my mom and both of my aunts. As an intern for an OBGYN fertility doctor, I have seen the degenerating effects of this disease firsthand. Efforts to uncover more information regarding endometriosis are ongoing today. So today I will explain some of the recent experimental findings of endometriosis in academic journals. I will discuss the procedure and results of an experiment regarding pelvic pain and antioxidant supplements. I will discuss the procedure and results of an experiment regarding pelvic pain location and the surgical findings of endometriosis. I will discuss the procedure and results of an experiment regarding endometriosis and pregnancy in a mice model. In 2013, Santana and colleagues conducted an experiment to see if antioxidant supplementation would reduce endometriosis-related pelvic pain. This procedure involved testing both all pelvic pain, inflammatory markers, and dysmenorrhea, which is pain associated with menstrual cycles. He tested 59 women ages 19 to 41 with a history of endometriosis and infertility. Patients were randomly assigned to one of two groups, one given vitamin C and vitamin E supplements, and another given a placebo fake pill. Women were asked to take an assessment of pain and quality of life questionnaire before treatment, twice a week during, and after treatment. After 8 weeks of treatment with antioxidant supplementations or the placebo, they underwent laparoscopic surgery to take out peritoneal fluid to re-examine the inflammatory markers. The results were statistically compiled to compare the experimental and control group. The antioxidant supplementation was found to significantly decrease the inflammatory markers. From the pain assessment test, none of the placebo group saw any improvement in everyday pain associated with endometriosis pelvic pain. However, 43% of the group that received antioxidant supplementation saw a decrease in everyday pain. Lastly, 37% of the group that received supplementation saw a decrease in dysmenorrhea versus 30% of the placebo group that also saw a decrease in dysmenorrhea. This last experiment, you saw that antioxidant supplementation may decrease everyday pelvic pain. And in this next experiment, we will see how the location of this pelvic pain may relate or may not relate to the actual surgical location of the endometriosis. In a 2011 experiment, Dr. Su and colleagues considered patients with biopsy-confirmed endometriosis aged 18 to 45 to test the relationship between pain location and the surgical finding of endometriosis. The process involved both testing the pain and laparoscopic surgery to detect the actual location of the endometriosis. First, using a compartmentalized diagram of the human body, patients were asked to articulate which exact points they felt pelvic pain. Next, laparoscopic surgery was underwent so as to record exactly where the endometriosis was. The endometriosis was then excised, taken out, and sent to pathology to confirm the diagnosis of endometriosis. The experimental findings were then compiled, as not all of the initial participants tested positive. Out of 133, 96 had biopsy-confirmed endometriosis. Out of the 96, it was found that endometriosis was not found to be associated with this specific location. The endometriosis was not found to specifically be related to the pain location. So in conclusion, the pain location is not necessarily related to the surgical finding location. As seen by Dr. Su's experiment, endometriosis is still undergoing research to fully understand all of its effects. In this next experiment, we will look at its specific effects on fertility. In 2015, Biolatas and colleagues conducted an experiment to evaluate the effect of endometriosis on fertility and the effect of pregnancy on already existent endometriosis growth in a mouse model. So, this process involved endometriosis induction in mice, mating, and surgery to assess their condition. First, 2-month-old mice were either underwent surgery to either induce endometriosis or were given a sham surgery as a control group. Then, 4 weeks later, the mice were mated, and 18 days later, they were sacrificed. Immediately after being sacrificed, they underwent surgery to assess their endometriosis and pregnancy if it occurred. The surgical results were used to draw conclusions on endometriosis related to the pregnancy rate, the litter size, pup weight, and the growth of the already existent endometriosis. The pregnancy rate was found to be much lower in pups with endometriosis. However, there was little significant difference in litter size and weight of the pups within the two groups. All the animals developed endometriosis because they were given it. However, the lesion size was much larger in the pregnant mice. In conclusion, endometriosis can negatively affect pregnancy rate, and it may increase the size of the already existent endometriosis lesions. You now know about endometriosis and a few of its complications. I discussed some of the recent research important to uncovering further knowledge. I discussed an experiment regarding pelvic pain and antioxidant supplementation. I discussed an experiment regarding pelvic pain location versus surgical findings of endometriosis, and I discussed an experiment regarding endometriosis and pregnancy in mice. Endometriosis is fairly common, however, it's not well known, so ongoing research is crucial. There are obvious implications for women, however, there are also implications for men as they are part of a family that may have trouble conceiving. For that reason, it's important for both men and women to be aware of endometriosis, what it can do, and support research to uncover further knowledge of what it may be capable of doing.